We have to have calcium. So basically, we're left with two options. We can keep taking more and more calcium that isn't designed to be absorbed.
And risk kidney stones, among other things.
You mean that's not all? Not that kidney stones are a minor thing, especially if you've ever had them. But is that all that happens to calcium? Our bones don't absorb? They pass out in our urine?
No, actually, that's not all. And as painful as kidney stones are, they're not the worst thing that happens when you have calcium in your body that your bones can't absorb. If it doesn't make it into your bones, calcium has to go somewhere, right? It either gets filtered out by the kidneys and basically flushed down the toilet, or possibly forming stones, or it starts to collect in your joints and arteries. Calcium in the arteries, as we know, is one cause of atherosclerosis, which can lead to heart attacks and strokes.
So too much calcium, if it isn't absorbed, can actually lead to heart problems?
Heart problems, strokes, arthritis, kidney stones is not a good thing. Have a look at this study. This study took place in New Zealand, which is perhaps why it hasn't made headlines here. But 1,471 women were studied for 5 years, and they were given Citracal. It says in the study they were given that brand, and half were given a placebo. The results, in the 5 years of the study, the group taking Citracal were more likely to suffer some kind of cardiovascular event. Cardiovascular event being defined as myocardial infarction, angina, other chest pain, stroke, and even death.
But that's the big name brand, the one that's supposed to be so much better absorbed.
Well, compared to the calcium carbonate you get in most over-the-counter supplements, it is. But obviously, it still isn't the best option.
Either way, too much unabsorbed calcium leads to heart problems and kidney stones.
Right. So that's option one.